Hi there. Have you been experiencing pain during or after sex? Today I'm going to talk about why that might happen and some strategies of how you might manage that. Hi, I'm Dr. Catalina Lawson, and I'm a clinical psychologist. There's a lot of reasons why women might experience pain during or after sex. These can be either physical or psychological. One of the most common physical reasons women experience pain during sex is because we experience changes in our hormones, particularly our estrogen levels. As we age, or if we have a chronic illness such as cancer and need chemotherapy, or perhaps have a gynecological issue which requires either surgery or other medication, oftentimes these procedures or treatments can lower our estrogen levels. Particularly when that happens dramatically, women are going to experience a lot of discomfort because when our estrogen levels go down, we don't produce as much lubrication in the vaginal area, making our vaginas more dry, shorter, and more narrow, hence leading to pain during and after sex. I've even had some patients tell me that they experience so much vaginal dryness, particularly in the context of having chemotherapy, that they can't even walk. So when I tell you that this is actually a fairly common thing, it is. Up to ranges anywhere from 10 to 30% of women will experience significant pain during or after sex. So if you are feeling this, know that you're not alone. Now, some of the psychological factors that may contribute to women experiencing pain during or after sex can be distress, just being stressed in the moment or feeling anxiety or depression. During those times, we tense up and our body is hyper aroused and constricted. Then it's really hard to relax and actually enjoy sexual activities, and that can lead to pain. Another thing is that if you've experienced some type of trauma in the past, sometimes there's things that happen in our present lives that actually can trigger that trauma. And because sex can be a very intimate and we open ourselves up to be more vulnerable, it can actually be one of those triggers to some of that trauma, leading to a bit more pain during sex or discomfort. So now, what do you do about it? So one of the first things I tell my clients is, first and foremost, find out whether or not you have a physical reason for this pain. So start off with either your GP or your general practitioner, family doctor, or your OB-GYN, your obstetrician gynecologist, to actually get some tests done and see if there's any reasons that are contributing to this pain. One of the biggest reasons that a lot of women live with this pain is because they don't actually seek support. So the first place to start is with your GP or your gynecologist. Then, if it isn't something physical, then perhaps they can refer you to somebody like a clinical psychologist like myself, or a sex therapist, or even a physical therapist who might give you some exercises that you can actually do to manage that pain, but also strengthen the pelvic muscles to actually support yourself during sexual activities. The next thing I recommend is, if you are in a relationship, to first and foremost talk to your partner about your pain. Oftentimes women will just endure this pain and sit and experience that pain, and unfortunately, over and over, their sexual satisfaction is going down. But one more common reaction when women experience this pain during sex is that they'll just avoid sex altogether. And when this happens, unfortunately, what that sends is sometimes that makes the person feel a bit more feel guilty and then more distressed, which then exacerbates pain, which then ultimately can lead actually to more avoidance of sexual activity. And then what this does is then perhaps makes the partner actually think, wait, something's wrong. But at the end of the day, this silence leads to a big gap between what a woman might want in her relationship, and what she actually gets, particularly sexually. And if you're in a new relationship or dating, and you may not feel as comfortable talking about your sexual concerns, particularly something like pain, what you can also do is maybe focus on other sexual activities that don't involve intercourse or insertion until you actually feel like you can have an open dialogue with this individual. Okay? And not necessarily feel like you have to explain yourself, but not necessarily also avoid any type of sexual activity. So one of the strategies I also recommend that women try, again, once you've cleared with your doctor that there isn't, that you've addressed any physical concerns or contributing factors, is also to bring in some tools into the bedroom to help in that moment deal with that pain. So using things like lubricant, one that actually you like, and going to a sex store to figure out what works for you, starting off by using that and first trying it out on your own. Now, everyone has their different levels of comfort as far as how they feel playing with themselves or exploring their bodies, and of course that's very individual. But I do recommend that women try to use lubricant on their own first to really see what does and doesn't feel comfortable. So take some time to explore this on your own without that pressure of a partner in the room. Then you can ultimately bring the lube out to the bedroom and try that. Another strategy I recommend to women who experience pain during sex is focus on the foreplay. And keep in mind, foreplay starts way before we enter the bedroom. Some of that can be the way we gently seduce our partner or subtly do that, but it also can include a massage and really getting as relaxed as possible. I said earlier that oftentimes when we're distressed or stressed in general, we tense up. And so if you are experiencing pain, being relaxed is going to be one of the best things that you can do to actually manage that pain and also feel more comfortable with your body and with your partner during that sexual encounter. And then finally, again, once you've done all these other things or tried them, also try new positions, try different sexual positions that actually, using this as a time to explore your sexuality. Particularly in long-term relationships, couples tend to kind of have their routine. And so this actually can offer an opportunity to spice things up and play around a little bit in the bedroom. Again, sex is meant to be fun. So use this as an opportunity, particularly with a partner that you trust, to actually explore what does feel good. And so I hope these strategies help. If you liked this video, feel free to like it down below and subscribe to this channel and keep an eye out. I'm going to be giving weekly videos about how to cope with some of these common concerns regarding sex and relationships. Feel free to join my Facebook group at Psychotherapy Without Borders, or check out my website at www.drcatalinalawson.com. Cheers!